Hello, my name is Dr. Alex Dydyk. I'm the Director of Weight Loss and Wellness, as well as Director of Pain Medicine for HealthyU Clinics. I wanted to have a chance to talk to you about chronic headache disorders, which are very commonly seen. Mostly we're going to be talking about chronic tension headaches as well as migraines. And what are some of these kind of signs and symptoms? What do we do for them? What are the steps in management? And give you some good information today. Disclosures. I have nothing to disclose today. Outline, we're going to talk about the different types of headaches. You can see kind of on the diagram on the right, there's kind of a spectrum that kind of consists between migraine headaches and tension headaches. There's some overlap in between the two. There's various non-pharmacological options that we can discuss, really going into the details of what can we do to prevent headaches, as well as medications were often utilized to help with pain, as well as talking about some various interventional options and natural supplements we can utilize as well. So again, there is a spectrum of different types of headaches. Very common, most common type of headache is a tension headache, where you can get a band-like headache that goes across kind of your temple, kind of forehead. If it's kind of a unilateral on one side of the head type of headache, that may be a migraine, especially if it's very severe, often associated with things like nausea, sometimes sensitivity to light and sound, can be very challenging to manage as well. Also, kind of on this slide, we do see a lot of patients with sinus headaches, and those also can happen a lot depending on where you live, depending on the season as well. Some of the other types of headaches are listed on these slides are a little less common. We'll have a slide on overuse headaches as well, which can very be common if you're using over-the-counter pain medications, where they actually make headaches worse rather than better. Chronic migraines are one of the biggest reasons why, as a pain specialist, I will see people for headaches. Very large amount of population has experienced migraine, and then depending on if this is a one-time thing or an ongoing, will really dictate if it's considered an acute migraine or a chronic migraine. So 15 or more headache days a month is considered a chronic migraine headache, and usually your minimum amount of 4 hours duration of these headaches, and sometimes they can last for even days. Again, these are kind of one-sided, pulsating, very severe. Actually, the severity of headaches a lot of times really dictates more than anything if it's a migraine or something like a tension headache. I think I mentioned some sensitivity to light and sound, some nausea, and vomiting that are also associated with it. And you can imagine this is one of the number one reasons why people miss days of work as well as for school. And so it has a huge impact and really significant reduction in function, is work days lost, or just quality of life and time we can spend with family and friends and doing the things we want to do. That diagram on the right says there's estimated that 38 million Americans who experience migraines. 73% of those are women. And that's often due to an association with migraines that may be associated with the menstrual cycle and changing in hormones as well. There are multiple different phases to migraine headaches. They can often kind of feel like a headache is coming on, sometimes days in advance. And then there is a large, but not the majority of patients can experience an aura where they're feeling maybe some numbness or tingling or sensitivity to different sensations prior to the headache. Then there is the period of the headache, which again can last for about 4 hours to up to 3 days in some senses as well. That usually is only improved either with kind of sleep or laying down in a cold, dark room or medications a lot of times. And then there's kind of a recovery period, also sometimes known as a migraine hangover that can occur as well, where there's almost kind of like you're up all night for multiple days, or nursing a new baby at home, making the recovery process really significant. And then if we compound that with someone with a chronic migraine, we're talking about dealing with this 15 days a month. And you can see how much this has an impact on every single day. Even if you had a headache and your recovery is 1 or 2 days afterwards, or you feel that headache coming on days ahead of time, you're dealing with headaches every single day in some ways. When you come to see your physician, the workup for chronic headaches, is really based off of symptoms, severity, as well as kind of underlying medical history. And we're not here to kind of necessarily give you kind of medical advice over this, not the purpose of this conversation. But part of the workup a lot of times is a full neurological exam, making sure there's not some underlying secondary issue that can be associated with headaches. Sometimes, in my experience, I've been able to kind of catch some things for better or worse, and concerns for things like multiple sclerosis or strokes or things like that as well. And depending on how long someone's been having headaches and severity or the new onset of those headaches, imaging may also be required a lot of times as well. And sometimes that workup includes getting an MRI or even a CT scan. Now, there are multiple different reasons why we get headaches. And again, we're kind of switching back and talking about tension headaches, which are the most common type of headaches. They're usually more mild to moderate. Again, people can work through these headaches, but they can be really bothersome in terms of us being limited in the things that we like to do. In American society, we spend so much time on screens or looking at our phones or computer screens that eye strain can have a huge kind of impact on this. We all are dealing with stress in our lives and how that can impact things as well. I live in Phoenix, Arizona. It is 105 degrees outside today. Dehydration also plays a role with this. As a chronic pain doctor, I see patients all the time for neck arthritis or some limited mobility due to lack of motion because those joints are degenerating as well. Mood plays a huge role with this as well. We also talked about in an earlier slide how our hormone levels also play a role in these things. Headaches can have triggers, and so part of an ounce of prevention is worth a pound of cure with a lot of these things. So if we can prevent headaches, a lot of the work is done for us too. If we've had new onset headaches or ongoing headaches, we need to kind of know why these things are occurring, right? Is there a change to our sleep pattern? Has there been changes to our diet? Has there been an emotional or life stressor that has popped up in our life? All of these things play a very significant role. Even the foods we eat can act as a trigger, especially in migraines a lot of times, where certain foods can make headaches worse. Some things can make them better. Every once in a while, I see a patient who says, I don't want to drink as much coffee anymore. And I say, okay, so what did you decide to do? I used to drink 5 cups of coffee a day, and I stopped cold turkey 2 days ago. My guess is they're in the middle of having a headache, or that kind of changed because their body was so used to it. I've seen patients who have had issues with things that are very common in certain foods, such as MSG. That's very commonly kind of associated with Chinese food, where patients will get headaches and feel flushed and things like that as well. I also see some things that I've been told are very helpful, like chocolate, which I guess all of us wouldn't mind having a little bit more of. Eye strain, if we can take one slide away from most of this, is eye strain is a huge contributing factor to headaches. Ultimately, you can look at this slide, it kind of really goes through the whole gauntlet of the different symptoms. But if you're starting developing eye twitching or blurry vision or dryness and itching and sensitivity to light, all of these things are trigger kind of signs before you're about to have a headache as well. And so for my contact wearers, it's good for you to switch out your contacts sometimes and put glasses on. The other thing that is very commonly discussed is checking the size of the font on your screen or your phone. And it might not look cool to have a large font on your phone, but if you're getting frequent headaches, it might be worth changing because that eye strain is pretty significant. Also, the size of the screen really matters, because if the text is very small, or you're sitting too close to the screen or your phone, ultimately your eyes are darting back and forth, and you're really causing a lot of strain to your eyes, rather than if you're sitting far enough back where your eyes are doing too much to look at the entire screen at that point as well. And again, kind of circling back to sinus headaches as well, clogged sinuses, watery, itchy eyes, all those things kind of come hand in hand. And so again, there can be significant overlap again between these various types of headaches. And it's hard to tease out, but all of them can be associated with things like eye strain. Our posture plays a huge role in this as well. Very commonly, when someone's getting a tension headache, it really feels like they have tension developing in their temples or the frontal kind of muscles, or occipital over the back, tightness in their neck, and all of those things kind of play a role in this too. And so, we're not on the slides yet for treatment, but doing kind of manual massage of these kind of areas actually can do a really good job of helping release those. The other component to this is proper posture, right? So if we're laying kind of forward and crunched over our computer screens, we're doing that repetitive motion day after day, hour after hour, it'll start taking a toll, especially causing strain to those neck muscles. or even facial muscles as well. And that's when we start developing headaches as well. So proper posture is basically being able to have your head kind of straight on without it kind of tilted up and down, and being able to look at your target of whatever you're working on at that time. Kind of proper foot placement, proper hand placement as well. Now, switching gears a little bit, we're going to talk about what are some of the treatments of this. I have a headache. What am I going to do with this? So the most common thing that everyone reaches for is over-the-counter medications, right? So very commonly kind of taking things like Tylenol or aspirin or ibuprofen or naproxen. There's also some topical kind of treatment options people reach for sometimes, especially for the neck, I would say, for topical treatment options. Depending on someone's health concerns, there may be a reason to take or not take various medications, but generally, there's a stepwise approach of treating headaches, essentially for the purpose of this conversation when we're talking about chronic headaches. Generally, patients have tried many of the over-counter medications. And those are really more utilized for more acute headaches, right? If someone's having a headache on a daily or a one-off or on occasion more than on a daily occurrence or every other day in the case of chronic headaches, then they're probably very well utilized. But in terms of someone having chronic headaches, it's probably getting to a point where it's not the best treatment option. We don't usually like patients taking anti-inflammatories for every single day because it can lead to long-term kind of health effects as well. And that kind of brings us to a slide that I kind of preluded earlier, which is talking about rebound headaches, right? So let's say I was having, 4 headaches days a month, and or even a little bit more than that, and I started taking ibuprofen or Tylenol on a consistent basis, on maybe a daily basis, because maybe some other kind of aches and pains in our body, let's say back pain or knee pain as well. And I've noticed my headaches have started increasing. So I'm not getting headaches 4 days a month. Now I'm getting headaches 15 days a month. Well, there's a very, good evidence to support something like a rebound headache that's actually occurring, where those medications are actually making the headaches worse and not better. And a lot of times our first line treatment for this is decreasing the amount of use of those medications, and often the headaches get better. And that's pretty remarkable to see. And again, it's because medications such as ibuprofen and Tylenol are so commonly used in their over-the-counter medications. There is a laundry list of medications that are utilized for both preventative and abortive therapies for both chronic tension headaches as well as chronic migraines. Going in on a slide of every single one of these kind of outside of the scope of that, I think a lot of times, it can seem overwhelming with these various medications. A lot of times the way these medications are selected, again, they are based off of if we are having symptoms that are occurring daily, or if they're more of a kind of a once a week kind of thing. The other thing, it really depends on someone's symptoms. If someone has a very large amount of nausea associated with their migraines, we might select a medication that may be helpful for nausea more than anything. If someone has a secondary underlying medical problem, such as high blood pressure, we may be more likely to reach for a medication that also treats not only for headaches, but also for high blood pressure. Similar goes for medication that can be used for things like anxiety and depression as well. And so this is how kind of medications are kind of selected and kind of teased out. And we'll have a slide on one family of medicines as well called the CGRP inhibitors, but these are kind of a breakthrough kind of medication that's often kind of utilized for headaches as well. They can do a great job of disrupting headaches and really reducing the severity, the number of days a month that someone's experiencing chronic headaches, specifically migraines. So what does this stand for? So calcitonin gene-related peptide inhibitors. These are medications that really help kind of release substances in the brain that really help with reducing inflammation around the brain that can occur and associate a lot of times with migraine headaches, and that's where a lot of times migraine headaches can come from. There are medications that can be done orally. There's injections as well as IV treatments for this as well. A lot of times our conversation around these medications they're excellent. I think the conversation with every doctor has with their patients is one of when can we get these medications approved with someone's insurance? And sometimes it requires, sometimes there's not a lot of red tape associated with it. And so we're reaching from these medications very early because their side effect profiles are really, really good. Sometimes there's some challenges of getting medications approved. And so part of what we do here at HealthyU Clinics is really kind of work with you, but also kind of working with insurance companies and trying to advocate for you to show you that these medications work they can be very helpful and can really significantly improve your quality of life. Switching gears again, talking a little bit more about what are some interventional kind of options that we can kind of do. I see patients all the time as a chronic pain doctor who have a lot of what we call trigger points or myofascial pain, where they get a lot of tightness and spasming in the various musculature. And the most common spot that we see it, as you see at the diagram on the right, when someone's reaching for their shoulder, is tightness in the muscles of the neck and the shoulders. The most common one is the trapezius muscle, which is the big diamond-shaped muscle that connects from your neck to your shoulders and down your back, as well as these rector muscles that kind of go to the base of your neck as well. Doing these injections is really a needling technique to help release and relax these musculature. And it can have a really significant impact on not just kind of neck pain, but also the headaches that are experienced with it as well. There's also overlap, if you hear the term myofascial pain, with things like fibromyalgia. Fibromyalgia is a widespread pain disorder that we diagnose and treat, and it's outside the scope of this conversation, but I do see it often, very oftenly associated with chronic migraines and chronic headaches as well. And we have those conversations as well, because that also, like the previous slide when we talked about medications to select, if someone has underlying fibromyalgia, there may be better medications that both treat headaches and treat the underlying fibromyalgia and joint and muscle pain that's associated with it as well. One of the coolest technologies and treatments that are out there is how Botox has been starting to be utilized for chronic migraines over time. And I've seen great success with this as well. If patients are having ongoing kind of chronic migraines greater than 15 days per month, as well as ongoing headaches that last 4 hours, they're over the age of 18, they've tried multiple medications. Once every 3 months injection of Botox has been shown clinically proven to decrease the number of migraine headaches and the severity of these headaches. And people do very, very well with this. In terms of injections, it might look like there's a lot of spots that we target. There are multiple spots that are targeted in the front, the temple, the back, and into the shoulders. The needle is very tiny, and there's a very small amount of medication that's injected in each spot. But it is a great tool and something that we try to utilize for our patients as well. Good news is there's not much side effects that are associated with it, which make it a great adjunctive treatment for migraine headaches as well. I'll also see, and this is associated with myofascial pain, but sometimes the spasming can get so severe in someone's neck where they can actually develop dystonia, which there's almost kind of painful contractions of the muscles. This can also be kind of treated with those trigger point injections, but also be treated with Botox. And again, these kind of go in conjunction. When someone has poor posture, when someone has eye strains that are associated, let's say, with a chronic kind of head kind of movement and spasming, they'll develop headaches, as well as that contractions of the musculature there can affect blood flow and kind of cause the irritation pattern as well, or just general kind of chronic pain and stress that's associated with it. So we are a sum of all of our parts. We're not just kind of one, we're not just headaches, right? So if we have underlying neck spasms and neck issues going on, there's a likelihood that we'll have headaches as well associated with that. With that said, if we're looking at those structures even deeper, you can develop things like a cervicogenic headache. So a cervicogenic headache can often be associated with arthritis or narrowing of the joint spaces in our neck. To move our head is a movement of different joints in our neck. And if that joint space becomes narrow or arthritic because there's loss of cartilage in those joints, they can become painful. Those nerves can become irritated, and when that occurs, it can lead to headaches, as well as irritation to nerves in the area of where these arthritic changes are. And so there's one very common area in a nerve called the third occipital nerve that's associated with headaches that kind of shoot from the neck to the back of the head, very commonly treated. And one way we treat that is with doing something called a radiofrequency ablation, where we can burn these little nerves in someone's neck associated with arthritis and having really significant improvement of both neck pain as well as headaches. We'll do this and screen this. This is not a one-size-fits-all, but if someone does have significant neck pain and arthritis in their neck as well, we do look for this. And we do these procedures a lot of times in our outpatient offices where we have an x-ray machine as well. We have really good success with this as well. One thing that's always kind of worth mentioning is talking about atypical facial pain patterns. And so you may see patients that develop something like called trigeminal neuralgia, where there's irritations of the nerves that sense our sensations in our neck. They can be associated with things like shingles or post-herpetic neuralgia, which is another common name for chronic pain associated with shingles, or nerve compression, maybe post-surgery, post-trauma, things like that as well. And facial pain and headaches sometimes can be the same conversation. Someone says to you, I have a headache. You say, what do you mean by you having a headache? You're saying it hurts kind of right here. Well, that might be more of an atypical facial pain pattern rather than a headache specifically. Also, a great kind of treatment option that we kind of reach for more and more is some natural supplements, including CBD and THC options. Not always the first line treatment option for this, but when we're having this conversation with patients, our goal is to say, what are we interested in? What do we want to have a discussion? In the state of Arizona, marijuana products are basically recreational, but there's also medical marijuana. And we have these conversations as well. THC does not have the psychoactive component, or I'm sorry, CBD does not have the psychoactive component that's found in THC that can make people feel higher altered, and can be really utilized a lot as a good treatment option for chronic pain and headaches as well. And then some patients, and I've had multiple patients anecdotally tell me, they do well with a combination of CBD and THC options as well. It's a conversation to have. It's a conversation that we help patients with, help navigate, especially when there's a lot of unfamiliarity with these types of products. But that's our job to do, and we see a lot of good success, and patients are very big proponents of it. Also, various natural supplements that we do carry. Some of these we carry in-house as well that can be utilized for our patients. Part of these kind of supplements can be utilized to decrease inflammation, things like turmeric, for example. You'll see a lot of patients on Migranol, which have a complex B vitamins as well in there as well. Sometimes it is electrolytes that are deficient, and you'll see as magnesium is a commonly prescribed supplement for migraine headaches. Fish oils do help with our neurochemistry as well, and also is commonly utilized in migraine headaches as well. Again, if there is vitamin deficiencies, if patients are interested in natural supplements and they want to explore these options, it is part of our integrated approach to taking care of patients to go over all of these options with patients. So that was a lot of information that we kind of knocked out in about 20 minutes. So the purpose of this conversation is talking about kind of the various types of headaches that are chronic in nature, which is generally over 15 headache days a month. It's a spectrum ranging from tension headaches to migraine headaches and everything in between. Thank you for taking the time with me. I'm Dr. Alexander Dydyk. What we do here at HealthyU Clinics is here to take a holistic patient approach to treating your pain, which includes one of the most common causes of pain, which is migraine headaches, as well as tension headaches. One of the most common reasons why people miss work and school in the United States, and our goal is to be able to get you back to the things that you want to be able to do the most and improve your function, improve your quality of life. Know that we are here for you to help you any way we can. So thank you for your time, and please feel free to reach out to us if you'd like to see us.